what I was saying is that as you get older, because this is my take on it. As you get older, you got to forget physically you are older. Mentally, you're still young. But when you get sick and you get injured, you don't rebound the same way. And so you can't be stubborn. And so if you feel ill, if you, and your cough persists, you should go see a doctor. Okay, don't wait till the last minute. Yeah, pneumonia is bad. You hear pneumonia, you don't think it's a good thing. I mean, it's not that bad, but systemically, it can really kick your butt. All right. So some of the stuff that we're going to be talking about today, you'll recognize some of the slides because I've also introduced this in 153 when we talked a little bit about contrast media and anaphylactic shock. Look at this. See that right there? It's a belly ring. I don't know if you guys saw that. It's a belly ring. So, performing venipuncture, you need to be knowledgeable of what can happen when you are pushing contrast media into the patient's vascular system. And so, as I mentioned before, it's not like performing just venipuncture to draw blood. There's a lot more at stake here because whatever you're injecting into the patient's body can cause some pretty bad effects. So, many specialized radiographic procedures require the administration of contrast media because if you look over here, bone is very obvious. Bone is white, okay? And it's white because it has the ability to attenuate X-rays and it doesn't interact with the image receptor, resulting in a white type of contrast. Anything that's easily penetrable interacting with the image receptor, this is where you get your different variances of densities. So what we do is we introduce contrast. We've talked about here's a barium enema, okay? So we give contrast to highlight or delineate the structures from the rest of the anatomy, and it mimics the same characteristics of that of bone, which is dense, so it has the ability to attenuate, resulting in areas of the image that are white. So again, it's just like bone. So here's an example down at the very end where we inject contrast into the veins. Blood goes throughout your body, it collects into the kidneys, and that's why the contrast is in the kidneys. So there we have two kidneys, the ureters, and then the bladder. Okay? So the main component of modern injectable, and that's the key, it's injectable, radio opaque contrast media is iodine, and its atomic number is 53, whereas barium is 56. We mentioned in this past lecture and also last week that barium is more dense with 56, and the alternative would to visualize anatomy, if there's any type of contraindication to use barium, we would use iodine, but it's only 53. So it's a little bit harder to visualize that radiographically. It's radiopaque, meaning that it is a positive contrast agent. And most type of the contrast that we use, injectable, again, we're talking about injectable, most of the contrast that we use, iodinated contrast, is water-based, meaning that your body absorbs it. Okay. So when your body absorbs it, it goes into your vasculature, and then you eliminate it when you go urinate. Okay. Same thing can be applied when we are giving it, if we were going to give it orally or rectally. Okay, because the iodine is not just strictly for the vasculature. We can also use it to highlight other organs. And the same concept applies. If they drink it, your bowels absorb it, goes into your circulatory system, and it ends up in your kidneys, and then you eliminate it that way. Okay, it's water soluble, it's absorbable. Some procedures require oil-based or water-insoluble iodinated contrast, where it persists longer and it's not rapidly absorbed nor easily mixed with the body. They have used those for hysterosalpingographies, xylographies, and also myelographies. This will be introduced to you guys by Ms. Mitz in her class if she hasn't already covered it. Okay? So you guys will cover that later on. They're slowly getting away from the oil base because it does persist in the body a little bit longer. When I was a tech, there were patients who had myelograms, and I would take a previous study of a myelogram, I would take a picture of their back looking at the sheath of their spinal cord, and I'll say, oh, when did you have this procedure done? And they'll tell me, oh, I had this done like 15 years ago. So contrast that this oil base that was done 15 years ago was still persisting in their system. And so that's why they're slowly, I shouldn't say slowly, but probably not using it as much as they used to. But it's just more forgiving when they use oil-based. But I think they're learning how to use some of the other iodine-based type of contrast material. So water-soluble, again, multi-purpose. You can use it in the vessels, in the organs. In vessels, it mixes with the blood and is eventually excreted out by the kidneys. In organs, it is reabsorbed into the bloodstream by surrounding body tissue, and then again, eventually excreted out by the kidneys. The misconception about iodinated contrast is they call it a dye, but it's really not a dye because it's colorless. It's clear. In your guys' assignments, have you guys had an opportunity to look at the different contrast media they use in your department and other departments? Have you guys started that already? Yeah. For some of you, yes. Some of you know. Okay. But see, if you look here, they all look the same. But what makes them different is their concentration of iodine. Okay? So most are colorless and transparent. Its ability to enhance visualization of structure is due to its ability to, again, attenuate X-rays. All modern-day iodinated contrast media is structured into what is called a triiodinated benzoic acid, 3-salt molecule. Iodine, salt, right?
Iodine salt.
Iodine salt. Okay, it's a salt molecule. Iodine. Okay? When you buy salt, it's iodinized salt. Okay? So for just the purpose of discussion, I'm not going to get too much into the chemistry aspect of it. We're just going to do an introduction to this, because I think it's beyond our scope to understand the molecular structure. I'm not saying that you guys are capable of doing it. I just don't think it's appropriate at this time. Just what we need to discuss are the effects of contrast media, but I'll give you an introduction of the molecular structure. So it's water-based contrast. It comes in two different forms. You have ionic and non-ionic. Okay, it's still iodinated. Okay, iodine. What we're talking about is molecular composition, ionic versus non-ionic. They can come in forms of monomer or dimer solutions, and the specific characteristics are based on the number of particles of molecule and the number of types of side chains attached to the basic iodine atom. Again, I'm going to keep it very simple. The use of the contrast that we use is physician dependent. We use different contrasts, different iodinated contrasts for visualizing different anatomy. They're not all the same. Okay, so they are procedure specific. And then here we have a summary of the different types of contrast. So this is what you guys will be seeing when you're opening up those cabinets. Are you guys familiar with Omnipaque? This is the most popular brand right here. How about IsoView is another one? Those are the two most common. Optiray is another one. Hypaque. Okay. Those are all the brand names. And you will see here that some of them are categorized as being ionic versus non-ionic, high osmolality versus low osmolality, and I will explain this to you guys here in just a bit. And then what they're used for. Okay, up here at Conray can be used for multi-purpose. Here IsoView is just vascular. Omnipaque is vascular, also myelography, but can also be multi-purpose. Okay. So there are specific concentrations that we use, again, that is intended for use on a specific anatomy. Okay. So just take a look at that. I would say be familiar with this chart, okay, because you may get tested on that. And again, you may not understand this now, but you will understand this in about 10 to 15 minutes. Okay? So in order to completely understand iodinated contrast media, it is necessary to understand these key terms. Also keep in mind that fluids in the body are always in a state of what we call equilibrium. And so the way contrast works is that it challenges these ideas. So the first one here is osmosis. Osmosis, you guys are familiar, is a diffusion of molecules through a semi-permeable membrane from a place of higher concentration, okay, into a lower state of concentration until it equilibrates. Okay, now you have equilibrium on both sides. Osmolality controls the distribution and movement of water between body compartments and is the concentration of molecules, okay? So the key here is when we're referring to osmolality, this is the key phrase right here, is concentration of molecules. In this case, the molecules that we're talking about here is iodine. Okay, so osmolality refers to the concentration of molecules and describes it in weight of water. Okay, so the solution that we use is iodine and water. A highly osmotic agent like radiopaque contrast will attract water so that dilutional effects will occur to equilibrate pressures between two permeable or semi-permeable membranes. So this is what it means. And so bear with me if you've seen this before. All right, so here we have the vasculature. Okay, and then here we have surrounding tissues around the vasculature. Contrast is highly osmotic, meaning that it's thick and it's viscous. Okay? It doesn't have the same consistency of that of blood. It's a lot thicker. Okay, if you guys remember the definition of osmolality, it's talking about the weight per volume of the concentration of molecules. Okay, so contrast is really thick. Okay, so now it's going down your vein. Your body's always in a state of equilibrium. So naturally, what's going to happen is because this is thicker, it's going to start sucking water and fluids from the surrounding tissues and organs into the vessel until it becomes equal. So this is one of the effects that iodine does. It's this shifting of fluids from the interstitial spaces. So it may change the composition of the surrounding cells. It may change the way it works. It may cause it to malfunction. But what's actually going on here is because it's sucking fluids from the spaces, it's going to dehydrate the surrounding cells. So radiopaque contrast in the bloodstream will cause fluids from outside the bloodstream to be drawn into the bloodstream until both sides are equal. Other intravascular constituents such as albumin, electrolytes, and sugars are being also diluted. All these are necessary for the metabolic process of your body. And now we are stealing those constituents because of this introduction of contrast media. So along with contrast crossing the blood-brain barrier, adverse reactions can also occur. So the response to iodine is several things are happening. It's not just one thing, several things are happening. Okay, so this is just one of them. Okay, so again, just remember, thicker material, equilibrium, trying to steal fluids from its surrounding spaces. So that's just one of the things that it does. Now, osmolarity, that's osmolality. This is osmolarity. Same as osmolality, but refers to the concentration of molecules per volume. Per volume. One is weight, the other one is per volume. So osmolality and osmolarity are often used interchangeably in reference to osmotic activity. However, one measures weight and the other one measures volume. Okay, just so you understand that there is a difference, because they do use those terms interchangeably depending on what you're reading. Okay, context of what you're reading. So radiopaque contrast, again, is iodinated. The first one here is high osmolality ionic contrast. High osmolality ionic contrast. Its molecular structure is a 3:2 ratio. That means 3 iodine items per 2 molecules. 3 iodine items per 2 molecules. It has a monomer configuration, and it's the most simplest model. And it can bond to identical molecules to form a polymer. This is going to be the most chemotoxic to the blood and body tissue because of its hyperosmolar state, meaning that it is, of the ones that we're going to discuss, it's going to be the most thickest and most viscous of the contrast agents. And here it's ionic due to its molecular composition. Although the salt molecule is stable when it disassociates, it can cause other molecules to also disassociate. So breaking bonds, joining bonds, breaking bonds, joining bonds. So whatever the contrast come in contact with, it makes the surrounding area unstable. Okay. Now here's the second one. It's called the low osmolality non-ionic. The first one is ionic. The second one is non-ionic. They still have iodine, but based on its molecular structure, it is not as chemotoxic as the ionic version. Okay, so the non-ionic is not as chemotoxic. So the osmolality is reduced by reducing the number of cations, which makes it less chemotoxic due to its decreased osmolality. So in plain and simple English, it still has iodine, but it doesn't have as much of it as the ionic. This has more iodine. This has less iodine. Again, keeping it in simplest terms. So then why do you have one or the other? So here are the pros and cons. Let's go over here. The first one. Because it has more iodine, visualization of the anatomy is much, much better. A lot better. Now what's the con?
Dehydration.
Chemotoxic. Okay? It can cause adverse reactions. But this would be preferable in imaging because it looks a lot nicer. Now this one here, it's a lot more friendlier, but visualization is compromised. It's compromised. And here's the funny thing, because there is less iodine, the doctor ends up injecting more because they can't see. So they end up just getting as much. Okay? But again, better for the body because there's no reaction to it. Okay? So of the two, what do you think is going to be more expensive? The one that causes effects or the one that does, or the one that doesn't cause effects?
No, it doesn't.
None.
The one that doesn't cause effects. Yeah, so this is more expensive to purchase. Right? But here's my thought. Get the non-expensive one because if they have an allergic reaction, now it's going to cost the hospital money, okay, in trying to reverse this reaction. If they go on a code, that's even going to cost them even more money. So might as well just do this in the first place, okay, and save on the worst results. Does that make sense? All right, and the third one here is a combination of both. It's a combination of number one and number two. It's low osmolality, but here it's ionic. Remember in the first slide, ionic meant that it had more iodine. Because it had more iodine, the effects of it is a lot more lethal. Well, they were able to manipulate the molecular structure so that you had the best of both worlds. This has a lot of iodine, but because of the molecular structure, it doesn't have the same effect. More iodine, less lethal. So it's a combination of number 1 and number 2. So it has the same structure and configuration of number 2, but reacts similar, configuration of number 1, but reacts in similar as the non-ionic. So here it's a 6 iodine atom per 2 molecule. Are you guys seeing the concentration here? So if you guys over here, 3 to 2, so you have a total of 6 iodine atoms. There's 6 iodine atoms here, right? And if you look over here, we have, it's 3 to 1, so you only have 3 iodine atoms here. And that's why it's less toxic. But now they're able to manipulate it, so now here you've got a total of 12 iodine atoms. And it's not as chemotoxic as the first one. All right, so we're still talking about osmolality. Let's talk about osmolality in human biology. So osmolality, again, we're talking about the concentration of molecules. Is it per weight or per volume? Per weight, okay. So per weight, per kilogram. So osmolality, in contrast, is determined by the number of particles in the solution. Human blood has the osmolality of 300 milliosmoles per kilogram. Human blood. The ionic contrast, okay, the one that has a lot of iodine on it, is 4. Is it 4? Yeah, 46 times more in osmolality than human blood. This is super thick. And so this has the ability to even draw more fluids from its surrounding spaces to equilibrate. And then if you do non-ionic, well, look at it. It's pretty close and similar, right? Okay, almost close and similar. And that's why the effects of those fluid shifts is not as apparent with non-ionic. Therefore, with this high osmolality, contrast could easily penetrate blood cells. Again, that's referring to sucking out the fluids from the interstitial spaces. All right, and this is why we prefer this, because it's so close to the osmolality of blood. But again, the downfall for that is that it's not as well visualized. So ionic RCMs, we said had 3:2 ratio, and they came up with this thing where they come up with the number. This number refers to the osmolality in context. So ionic contrast has 3:2 ratio, and the number that they figured was 1.5, which is this, 3 divided by 2. And non-ionic is 3 divided by 1 with a number 3. In summary, what it says here is RCMs with lower osmolalities have a higher numerical value, meaning that it is less toxic to the body's tissue and therefore produces fewer adverse reactions. So when we're looking at this, it looks a little confusing, but what this is referring to is how much of this volume is not iodine. In other words, we're talking about the solution in which the iodine is in. Okay? So when we look at 1.5, it means that there is not a lot of solution in there, and there is more contrast within that solution. Here, there is more solution and less contrast, so this is more diluted. The higher number means it's more diluted. The lower number means it's less diluted and has a higher concentration of the iodine molecules. Does that make sense? So the number then is referring to the solution in which the iodine atoms or molecules are in. So the higher the number, the more diluted it is, the less concentration of iodine. And that is why non-ionic has a high number of 3. All right, any questions?
Do we have to have a test on it?
Again, I'm just trying to teach you guys the concept. Okay, so if you go back over here now, this should make sense. You've got your ratios, the difference between high osmolality versus low osmolality. So high means higher concentration of iodine, low means lower, okay? And so ionic, high osmolality, non-ionic, low osmolality, and then over here is, I think it's the only one that's the 62 that has a lot of iodine, like the 3 to 2s, but doesn't have the same effect, and it's like the 3 to 1. Okay. Did I answer your question?
No, never did.
Okay.
Still waiting.
Did my job.
Good, thank you.
I'm a master of circumventing.
I noticed.
Yeah. Okay. So iodine concentration. So iodine concentration of contrast will also determine its ability to absorb X-rays. The higher concentration, the greater the ability to absorb, and it's said to be more radio-opaque. Iodine concentration is usually stated in units of milligrams per millimeter. So, for example, if you are looking at 2 bottles of contrast, one says Omnipaque 300 versus Omnipaque 240, which of the two has more contrast?
300?
Okay, this one. Okay, but here's an example. This is why we have differences. I would use this for most vasculature, but I wouldn't use this for my carotid. Okay, because it's much thicker. It's also taking up the same space as oxygen in my blood vessels. So if we inject that into my carotid, into my brain, it's going to feel like somebody just hit me with a sledgehammer. Okay. Same context. If I were to inject this amount of iodine content, Omni 300, down my femoral artery, it's going to feel like somebody chopped off my leg, because my leg is not receiving oxygen because it's occupying the same space. And so I would use 240 for my femoral, or I would use 240 for my carotid. Does that make sense? All right, we all know about viscosity, right? So viscosity of contrast is a measure of fluid to flow, and it's determined by the number of particles in the solution and the attraction among these particles. So higher iodine concentration, like your ionic contrast, tend to have higher viscosity. And those with lower iodine concentration, like your non-ionic contrast, has a lower viscosity, but again, it's not visualized as well. Toxicity. The toxicity of contrast on the body, tissue, and organ is related to the contrast's chemical configuration, their osmolality, their iodine concentration, and yes, the injection rate. Contrast in delivered vascularly can be injected very slow or very rapidly. So contrasts that are non-ionic, that's the one that's less viscous, have low osmolality, low iodine concentration, and when injected slowly, tend to be less toxic and produce patient reactions or side effects. Okay? So that's the ultimate combination. Low osmolality contrast and also at a slow rate will produce the less amount of side effects. okay? And so here it is again, okay? Another version of it. Ionic 3-to-1, high osmolality, very thick, more toxic, more viscous, more iodine, more opaque, okay? And then low osmolality, less toxic, less viscous, less iodine, less opaque. And then here, the 6-to-2, you have all these, okay? It's less toxic and less viscous, but it has more iodine and it's more opaque. So you have the best of both worlds. Now, of these three, which one do you think is going to be the most expensive?
The 62.
The one way down over there. Okay? Because this is the Ferrari of the group. You get all the bells and whistles. Okay, anaphylaxis. So anaphylaxis, an allergic reaction, basically what an allergic reaction is, it's a response to your body of an antigen that was introduced before. You guys remember 153? Okay, patient care. So let's just say you got stung by a bee, nothing happened, okay? The venom that entered your body, it was the first time it was introduced to your system, and so it really doesn't do anything. But in your body's response, it starts to build up these different types of antibodies and defenses to that. So the next time you are stung with a bee again, now your body will respond, and that's your allergic reaction. So nothing happens the first time, and it happens the second time it comes around. So that's what an allergic reaction is. You guys recall that? Okay. So an allergic reaction to an antigen that was previously encountered by the body's immune system. Now, contrast is a little bit different, okay? Because the response to iodine is not true. It's not real. Because iodine it's not considered foreign, it's not considered an antigen. But what it causes is it causes chemical changes in your body to make it think like it's a foreign material, and your body ends up having an allergic reaction, or worst case scenario, you have an anaphylactic reaction. Therefore, the allergic reaction that your body has in contrast agent is called an anaphylactoid reaction. It mimics anaphylaxis. It mimics it. It's not real. Okay? It's not real. So the introduction of the contrast material causes biological and molecular changes in your body that causes it to release these histamines and complements and things of that nature that makes it think like it is a foreign material, an antigen. So with that said, contrast agents are unpredictable in their responses, which means that just because you didn't have a response before doesn't mean you're not going to have a response now. Just because you had a response back then doesn't necessarily mean you're going to have a response now. It's unpredictable, okay, because it's anaphylactoid. It depends on how your body responds to it. Sometimes it does, sometimes it doesn't. You follow? So it's unpredictable. It used to be that you can take iodine and do a skin test, put it on the skin and see what happens, but it's not really vascular because we need that in your vascular system to determine whether or not you are going to get a response to it. So they used to do skin tests. It doesn't work. Okay? Just like what they do with when you're having allergy tests. Anybody have allergy tests? And they put that stuff on your skin to see if you react.
He did it all on my back.
Did all? Yeah. You can't do that with contrast. It doesn't work. Okay, so it's unpredictable. So previous injection of iodinated contrast with no adverse reaction may still experience a response. And then conversely, someone having an adverse response to a previous injection of contrast may experience nothing the next time. Okay. So, previous allergic response is still considered high risk. So, most hospitals now have a policy where they take a cautious approach. It doesn't matter if it's iodinated contrast or, non-ionic or ionic contrast, it doesn't matter. Most hospitals now have a policy where they pre-medicate their patients for preventative measures. They will use stuff like Benadryl. Benadryl is what? An antihistamine. Phenergan, Solu-Medrol, and Solu-Cortef are all different types of muscle relaxers. They are steroid. They are steroid in nature. Steroid, not like steroid to, ritual above. Okay, but this steroid is a muscle relaxer, and I will explain this in just a moment. But you have an antihistamine, you have steroid. It's preventative measure so that when the patient gets injected with contrast media, they shouldn't have an allergic reaction. Now remember, it's anaphylactic. Just because it's done for preventative measure, they still may have a reaction, but it won't be as
Prominent.
critical, okay? So the objective here for pre-medicating the patient before they get the contrast media is to prevent any type of reaction or minimize the effects, okay? There's nothing fail-proof about this. Nothing fail-proof. Most reactions occur following an intravascular injection of relatively large amounts of iodinated contrast, such as those in intravenous pyelogram, that's IVPs, angiograms, and also CT procedures. Now, what you'll be doing as a technologist, before you inject the contrast material, there's going to be a series of questions that you're going to ask your patient. Ms. Smith, have you had this procedure done before? Did anything happen when you got that injection? Ms. Smith, do you have any allergies to foods or medications? Ms. Smith, do you have asthma or hay fever? Okay. All these questions are important because if they say yes to any of these, the likelihood of them having an allergic reaction increases. So for example, if they have allergies to certain foods or pollens and things like that, they increase their chances of an allergic reaction by 2 times. If you're asthmatic, if you have hay fever, it increases your chances of having an allergic reaction by 3 times. And then previous history of a reaction, it increases your risk by 3 times. Okay? But again, it's unpredictable. Just because it happened before, it may not happen again. And just because it didn't happen before, ooh, I'm gonna relax, all right? You're gonna let your guard down? Never, ever, ever let your guard down when you're dealing with contrast. You guys are familiar with universal precautions when it has to do with bloodborne pathogen. There is also a universal precautions that we take with iodine, in that you treat every single patient that you come in contact with who receives iodine as if what?
He's gonna
They're
react.
gonna have an allergic reaction. You gotta think worst case scenario. You gotta think worst case scenario every time. Okay, never let your guard down. Because the moment that it hits the fan, okay, and you're not prepared, turns out bad, okay? So severe reactions to contrast, 1 out of every 14,000 cases, that's severe. Fatal is 1 out of 40,000 cases. Higher risk includes those that are over 50 because their immunity is a little bit weaker. They're dehydrated, so you're increasing your chances there. Pre-existing cardiopulmonary diseases.